Was the 2020 pandemic a real emergency? The 2020 pandemic, caused by the novel coronavirus SARS-CoV-2, marked a pivotal moment in contemporary history. Its rapid spread and profound impact prompted widespread measures and responses globally. To explore whether the 2020 pandemic was a real emergency, it is essential to examine various facets, including epidemiological data, healthcare system responses, economic repercussions, and social impacts. This episode delves into these aspects, offering a comprehensive analysis of the pandemic's status as an emergency. The 2020 pandemic, commonly referred to as the COVID-19 pandemic, began in late 2019 in Wuhan, China. The virus SARS-CoV-2 quickly spread across the globe, leading to unprecedented challenges for public health systems, economies, and societies. On March 11, 2020, the World Health Organization, WHO, declared COVID-19 a pandemic, emphasizing the seriousness of the situation. An emergency is typically defined as a situation that poses an immediate risk to health, life, property, or the environment, requiring urgent intervention. In the context of public health, an emergency is a situation that demands immediate action due to its potential to cause significant harm to the population. The COVID-19 virus exhibited high transmissibility, primarily through respiratory droplets and contact with contaminated surfaces. The basic reproduction number, R0, for SARS-CoV-2 was estimated to be between 2 and 3, meaning that each infected person could potentially infect 2 to 3 others. This rate of spread necessitated urgent public health measures to control the transmission. By the end of 2020, COVID-19 had caused over 80 million confirmed cases and nearly 2 million deaths globally. The mortality rate varied by region, age group, and the presence of underlying health conditions. Older adults and individuals with comorbidities were particularly vulnerable, with significantly higher mortality rates compared to the general population. The surge in COVID-19 cases overwhelmed healthcare systems worldwide. Hospitals faced shortages of beds, ventilators, and personal protective equipment, PPE. Healthcare workers were at high risk of infection, leading to staffing shortages and increased workload. The pandemic highlighted gaps in healthcare infrastructure and preparedness, necessitating immediate and substantial responses to prevent collapse. Comparing COVID-19 with previous pandemics, such as the 1918 influenza pandemic and the 2009 H1N1 influenza pandemic, provides context for understanding its severity. While the 1918 influenza pandemic caused higher mortality, COVID-19's impact was profound due to its rapid spread, high morbidity, and the modern interconnected world, which facilitated faster transmission. In the early stages of the pandemic, countries implemented various measures to control the spread of the virus. These included travel restrictions, lockdowns, social distancing, and mass testing. The effectiveness of these measures varied, influenced by the timing and stringency of their implementation. Testing and contact tracing were critical components of the public health response. Countries with robust testing and tracing systems, such as South Korea and Germany, managed to control the spread more effectively. However, many nations faced challenges in scaling up testing capacities and ensuring timely contact tracing. The development and distribution of vaccines were pivotal in addressing the pandemic. The speed of vaccine development was unprecedented, with several vaccines receiving emergency use authorization by the end of 2020. However, equitable distribution remained a challenge, with disparities between high-income and low-income countries. Healthcare workers played a crucial role in managing the pandemic, often working under extreme conditions. They faced increased risk of infection, mental health stressors, and burnout. Ensuring their safety and well-being was essential, but often difficult due to resource constraints and high demand. The COVID-19 pandemic triggered a global economic crisis, leading to significant contractions in GDP and disruptions in various sectors. The International Monetary Fund, IMF, projected a global economic contraction of 4.4% in 2020, the worst peacetime contraction since the Great Depression. The pandemic's impact varied across sectors. The travel, hospitality, and retail industries were particularly hard hit due to lockdowns and social distancing measures. Conversely, the healthcare, technology, and e-commerce sectors saw increased demand. Unemployment rates soared as businesses closed or reduced operations. The International Labor Organization, ILO, estimated that 8.8% of global working hours were lost in 2020, equivalent to 255 million full-time jobs. Informal workers and those in precarious employment situations were disproportionately affected. Governments worldwide implemented fiscal and monetary measures to mitigate the economic impact. Stimulus packages, unemployment benefits, and business support programs were introduced to support affected individuals and businesses. The effectiveness of these measures varied, with some countries managing to stabilize their economies better than others. Social distancing measures and lockdowns, while necessary to control the virus spread, led to increased social isolation. The disruption of social interactions had significant psychological impacts, including increased anxiety, depression, and loneliness. The closure of educational institutions affected millions of students worldwide. The shift to online learning posed challenges, particularly for students in low-income regions with limited access to technology and the internet. The long-term impact on educational attainment and disparities remains a concern. The pandemic exacerbated existing mental health issues and contributed to new ones. The uncertainty, fear of infection, economic hardship, and social isolation collectively impacted mental well-being. Mental health services faced increased demand, often exceeding their capacity. The pandemic led to significant changes in social norms and behaviors. Remote work became more prevalent, altering work-life balance and productivity. Public health practices, such as wearing masks and frequent hand-washing, became ingrained in daily routines. The pandemic underscored the importance of international cooperation. Organizations like the WHO played critical roles in coordinating responses and providing guidelines. However, geopolitical tensions and varying national interests sometimes hindered collaborative efforts. National responses varied widely, influenced by political leadership, public health infrastructure, and societal attitudes. Some countries, such as New Zealand, implemented strict measures early on and managed to contain the virus effectively. Others faced criticism for delayed or inconsistent responses. Effective communication was essential for public compliance with health measures. Misinformation and mixed messages from authorities sometimes undermined public trust. Clear, transparent, and consistent communication proved crucial in managing the public health response. The pandemic prompted discussions on long-term policy changes to enhance preparedness for future emergencies. Investments in public health infrastructure, healthcare workforce training, and global health security were identified as priorities. The 2020 pandemic was undoubtedly a real emergency, characterized by its rapid spread, high morbidity and mortality, and profound impact on healthcare systems, economies, and societies. The global response highlighted both strengths and weaknesses in public health infrastructure and emergency preparedness. Several key lessons emerged from the pandemic. 1. The importance of timely and coordinated public health responses. 2. The need for robust healthcare systems and infrastructure. 3. The critical role of international cooperation and information sharing. 4. The necessity of addressing mental health and social well-being alongside physical health. 5. The value of preparedness and proactive measures to mitigate future emergencies. The experience of the 2020 pandemic will likely shape future public health policies and emergency preparedness strategies. Investing in resilient healthcare systems, ensuring equitable access to resources, and fostering global collaboration will be essential in mitigating the impact of future pandemics. The 2020 pandemic was a defining moment in contemporary history, demonstrating the interconnectedness of global health, economy, and society. While the challenges were immense, the lessons learned provide a foundation for building a more resilient and prepared world for future emergencies.